ladies and gentlemen. On behalf of Shalby Hospital Mohali, we extend a very warm welcome to all our dignitaries, eminent doctors, esteemed media partners, corporate guests, and everyone gathered here today for a landmark occasion, launch of Advanced Gastro Sciences Department, expanding access to specialized digestive care. May I invite our dignitaries on stage for the traditional lamp lighting. Dr. Charanjit Singh, Dr. G.R. Verma, Dr. Pankaj Bhalla sir, Dr. Ravinder Goyal, Dr. Rahul Gupta, and Mr. Gladwin Sandeep sir. मैं आपके साथ So today, Shalby Hospital Mohali launches this department which enable us to manage complex gastrointestinal and condition with a multidisciplinary approach, combining surgical expertise like gastrosurgeon, gastroenterologist, interventional radiology, and oncologist and oncosurgeon with advanced technology for optimal patient outcomes. Let us now hear from the leader who has been instrumental in bringing this advancement to our patients. May I invite Dr. G.R. Verma, Senior Consultant, GI and Laparoscopic Surgery, to address this gathering. Can we have Dr. G.R. Verma?
Well, honorable dignitaries on the dais, thank you so much, Dr. Charanjit Singh, for accepting our invitation to grace this occasion. I really was thinking this occasion for quite some time, and have requested our Gladwin to organize the event because we, as the Department of the Gastroenterology, were engaged actually in all kinds of advanced gastroenterological diagnostic and therapeutic procedures, as well as the all kinds of advanced surgeries being undertaken for the last 2 years, ever since we have joined. So we were really looking forward for this occasion to formally being inaugurated as a facility in this hospital, so as to disseminate this information to the rest of the Tri-Cities, that all kinds of advanced services, open surgery and the advanced laparoscopic surgery, they are available under one shade, and that is the Shalby Hospital Mohali. We just wanted to tell you that the gastrointestinal system, as we all know, it's a cluster of multiple organs which are primarily involved in the digestion of the food, absorption of the important nutrients, and the excretion of the waste product from the body. In that, actually, it plays a role of overall health in the body and to provide the essential nutrient and the energy for the rest of the body to function. So in that, you can say it's a powerhouse of the body. It does provide the energy constantly so that all organs functions in a normal way. Gastrointestinal system actually is communicated with our brain by way of millions of neurons, hormones, and multiple billions of the bacteria in our gastrointestinal tract. Therefore, any change in our mental status is a symptom, mostly by way of, it may be a crampy abdominal pain, you may faint, sometimes you may experience an unusual borborygmy, abdominal distension, pain in abdomen, crampy abdominal pain, and when it is extreme, it can lead to sometimes with diarrhea and constipation. Majority of the gastrointestinal disease are functional in origin, and they may be because of your subconscious mind is feeling some kind of stress or depression, and it is reflected by way of the gastrointestinal disease. Therefore, when these kind of symptoms, they are not counseled in the beginning, they ultimately lead to diseases like the irritable bowel syndrome, what we call IBS, irritable bowel syndrome, inflammatory bowel disease, etc. Besides that, there are multiple gastrointestinal diseases like the gastrointestinal, the gallstones, and even the gastrointestinal tumor are being detected quite frequently nowadays with the advent of all advanced endoscopic procedures. Since the change of the lifestyle and the primarily the food habits and the sedentary lifestyle has brought a number of changes in our body system, and it is really responsible plenty of our gastrointestinal symptoms actually. Apart from these diseases are also responsible for creating a situation where the body does not react at a subconscious level or even a painless level to lead on to the chronic inflammation, but ultimately sometimes can even lead to the tumors. Gastrointestinal tumor accounts for nearly 20% of all the tumors in the body, and in majority of these cases, especially the best is the risk factors, which is known in almost all the cases, is either the tobacco, is the smoking, high fried food, red meat. And it is because of the change in the diet in the preceding, I would say, 30-40 years, that the incidence of gastrointestinal cancer have risen exponentially. Now, luckily, with investigation with the gastroenterology colleagues, many of the diseases can be diagnosed in the beginning if the patients are counseled that any symptoms of you, if it persists beyond 4 weeks after a treatment with your local practitioner, please do consult your specialist so that these diseases can be detected in the earlier stages. Shalby Multi-Speciality Hospital is proudly is announcing that it is a center of excellence for the gastrosciences, and this gastroscience center is being they looked after by all of a dedicated team of the gastroenterologist, GI surgeon, intervention radiologist, and the oncologist. And as a matter of fact, all the consultants, they are working either independently or with collaboration depending on the time of the cases, and they do discuss the cases among themselves so as to bring out the best treatment outcome patient can get. This is the purpose of a multi-specialty the specialty. They work in cohesion and coordination in the interest of the patient and to deliver the best treatment which is required in a given situation. Now, our experienced gastroenterologist, Dr. Rahul Gupta, I know is quite experienced and he is doing a lot of procedures which are the diagnostic as well as therapeutic endoscopy procedure. Of late, I think he has done a very important the capsule endoscopy is one of the very advanced kind of the diagnostic procedure which is performed rarely in cases of the GI, the bleeding of unknown origin. Similarly, another Dr. Ravinder Goel, I think he is also done. I think the last month only, he has successfully performed a metal stenting in a difficult case of carcinoma, advanced case of carcinoma gallbladder, and the patient went home successfully. So we can vouch for the experience and the competence of all the people are concerned. I'm also looking after the GI surgery along with Dr. Balla. We have got a reasonable experience of nearly 4.5 decades of surgical experience in gastrointestinal surgery, and make sure that the patient gets the best treatment in this hospital. At the end, I would say, since the gastrointestinal disease, many of them, they have the preventable causes like the poor diet, especially the fast food, the processed food, the red meat, alcohol, tobacco. I think these are the known risk factors of various gastrointestinal diseases. Therefore, if you really want to give a happy and healthy life, please avoid these kinds of the food, or instead I would encourage the people to use most of the fresh fruit and vegetables, have the lot of the salad, and have the whole grain diet like dalia, the khichdi, and all kinds of the sprouts, the upma, and the lots of green vegetables. If you really stick to this kind of food habits and avoid all those foods which are the risk factors of creating many problems, I think you can live a happy and healthy life. Thank you very much.